When it comes to rhinoplasty, this is one of the most difficult operations in plastic surgery because you have to account, when you do a rhinoplasty, three components that are integrated. One is shape, second is function, and third is the long-term durability. Function and shape are married. You don't want to obtain a nice nose that doesn't breathe well, or you don't want to obtain a nose that breathes well and doesn't have a good shape. Likewise, you want to do an operation that's going to have a long-term durability. One of the reasons why rhinoplasty fails, perhaps not in the first year or second year, but 5 years later, is because during the initial operation, the surgeon doesn't provide to the nose enough structural support to maintain the long-term stability of the nose and maintain opening of the airways so the patient will breathe well, or doesn't maintain the original structure that the patient has. That's why in my operation I call it the superstructural rhinoplasty, because the surgeon has to provide enough support so the nose will look nice with nice aesthetic lines, will have good function that won't collapse and affect the nasal airway, and last for long period of time. There's a difference between the primary and secondary rhinoplasty. The primary rhinoplasty, you can approach it through the closed technique, and you can maintain as much of the original integrity and structural support that the patient has. When you deal with secondary rhinoplasty, usually previous surgeons have already used the septum, the ear to graft the nose, and you don't have any other option but to obtain rib graft that give excellent structural support to the nose. And that can be done with very small incision on the patient's underbreast to obtain the graft. This graft gives enough structural support because they are strong, they are more rigid than the ear, for example, and give a more long-term stability to the nose. In my practice, about 40% of the patient comes for requesting secondary rhinoplasty from surgeries done somewhere else that has failed before. And I have seen patients who had 2, 3, 4, even more than 10 operations that I was able to help them.